to change of position when force are applied. This means that the denture should not be like this picture of a seesaw. The denture should be steady. This means that when apply pressure to the right side, the denture should not jump from the other side. This means that the denture are The various factors that affect the stability are vertical height of the residual ridge, quality of the impression, occlusal rim, arrangement of the teeth, contour of the polished surface, shape of the palatal vault, retention, and the proper. The vertical height of residual ridge should have sufficient vertical height to obtain good stability. The quality of the impression. An impression should be as accurate as possible, and the impression surface should be smooth and duplicate all detail accurately. So it should be devoid of void and any rough surface. And the impression should not wrap on removal. So the impression should be dimensionally stable, and the cast should be poured as soon as possible. For the occlusal plane, it should be oriented parallel to the ridge, and if the occlusal plane is inclined, then sliding force may be act on reduce tooth arrangement, balance occlusion, and the neutral zone. The position of the teeth in an occlusion that is balance occlusion, it will enhance stability of the prosthesis. And the teeth should sit in a neutral zone, which is the potential spaces between the lip and the cheek on one side and the tongue on the other side. This means that if we set the teeth in a neutral zone area, it means that the force applied from the outside lip and cheek muscle will be equalized by the force from the lingual side from the tongue. The contour of the polished surface of the denture should not interfere with the actions of oral musculature. And the shape of the vault, a steep palatal vault may enhance stability by providing greater surface area of contact and long inclines, right angle to the directions of force. The hard palate can be classified into U-shape, which is the ideal for retention and stability, V-shape, in which the retention is less as the peripheral seal is broken, the flat, in which there is a reduced resistance to lateral and rotary force. For the tongue, we have either favorable position of the tongue or retruded position tongue. The retruded tongue position may be congenital or acquired due to edentulousness. Tongue position affects stability and retention of complete denture, and favorable tongue position improves stability and retention of the mandibular. For the tongue, it should be examined for the size. Large tongue decreases the stability of the denture. Small tongue does not provide adequate lingual peripheral. And movements with coordination, tongue movements and coordination are important to register a good peripheral tracing, and they are also necessary in maintaining the denture in mouth during functional activity like speech, deglutitions, and stability decrease with the loss of vertical height of the ridge and increase in the movements of the tissue. For the support definition, it is the resistance to the force of mastication, occlusal force, and other force applied in a direction toward the denture bearing area. And maximum denture extension is essential in providing denture. Nature of supporting tissue. The soft tissue should be the mucosa covering the hard palate and the crest of the ridge, including the residual attached gingiva, is classified as masticatory mucosa, and it is characterized by a well-defined layer. The submucosa is firmly attached to the periosteum of the underlying supporting bone and will usually withstand successfully the pressure of the denture. The thickness and consistency of submucosa are largely responsible for support that the mucosa membrane affords a denture, because in most instances the submucosa makes up the bulk of mucous membrane. Hard tissue. There are two types of osseous tissue that form bone. the cortical bone, which is hard, strong, and stiff than the cancellous bone, and the cancellous bone, which is less dense, softer, weaker, and less stiff, which is typically occur at the ends of long bone. Mandibular anatomic considerations. For the buccal shelf area, it is found on the external surface of the mandible from the residual alveolar ridge, and this is the picture is the buccal shelf area, which is bounded anteriorly by the buccal frenum, posteriorly by the retromolar pad area, medially by the crest of the ridge, laterally by proximity muscle, mucosa, and the type of mucosa. This buccal shelf area considered as a primary stress bearing area. Why? Because it is covered by mucosa and with an interventing submucosal layer containing glandular connective tissue and buccinator muscle fiber, and it is parallel to the occlusal. The mandibular residual ridge, the ridge crest are reserved as a secondary support area, and the lack of muscle attachment, presence of cancellous bone. For the maxillary anatomic considerations, the horizontal portion of hard palate is considered as the primary stress bearing area, as it have a keratinized masticatory mucosa overlay a distinct submucosal layer everywhere. In the region of median palatine suture, the submucosa is very thin, and it is a result that the mucosal layer is practically in contact with the underlying bone. So for this region, the soft tissue covering the mid-palatine suture is non-resilient and may need to be relieved to avoid trauma from the denture base. In the area of rugae area, it is at right angle to the residual ridge, and it is rather thinly covered by soft tissue. These areas contribute in stress-bearing role through a secondary capacity, and the submucosa covering the incisive papilla and nasopalatine canal contain the nasopalatine vessel and nerve. The crest of the maxillary ridge, it is an important of supporting the denture. However, this bone is subject to resorption, which make its potential for support, unlike the palate, which is resist to resorption. This is the palate resist to resorption, and this is less likely to resist resorptions. And because of this, the crest of the ridge should be locked on a secondary supporting area rather than a primary structures. For the more support to the prosthesis, the use of dental implant to support the prosthesis, they call it an implant supported prosthesis by using of a dental implant. A dental implant improves support, retention, and stability of full and partial denture, reducing the slip movement while speaking. And thank you for your kind attentions and